How are you now positioning yourself that folks are becoming more aware of integrative oncology? It plays a significant role, and who and why should be coming to be part of that.
Everyone.
Okay.
If it's up to me, it's like everyone. The moment they get diagnosed
I agree.
with cancer,
I agree.
come to see us because we have so much to offer.
Well, welcome to another episode of What Rubbish, a holistic treatment to the breast cancer for from Al-Kauri Foundation. We're excited to be here today and present to you a very special guest. And I'm excited about this opportunity because today we are talking to the head of the Integrative Oncology Group at Dana-Farber, Ting Bao, Dr.
Yes.
Ting Bao.
Yes.
So I think we will dive right into it, Dr. Bao. And I think it will be a great opportunity for the audience to hear about yourself, your background,
Sure.
and what triggered you to become an integrative oncologist.
Sure. Thank you so much for having me. It's
You're
really
welcome.
a pleasure. Thank you. So I'm Ting Bao. I'm the co-director of Zakim Center for
Okay.
Integrative Therapies and Healthy Living. And so my story started 30 years ago when I first came to this country from China.
Oh, wow.
I was born and raised in Beijing, China, and then always want to get some kind of liberal arts education. So 30 years ago, I came to the United States, Wellesley College, became a student. Double majored in biochemistry and English. And
Oh, my goodness. Okay, so you had to learn English.
yeah. So the thing is, when I grew up in China, we'd learn like reading and writing, but not
Right.
speaking.
Right.
So when I first came here, I think many people think I was mute because I couldn't really speak.
Okay.
And then I realized the importance of language, and also I realized the importance of humanity, being able to communicate with people. So my future career, initially, I was going to be like a hardcore scientist. But then I decided my future career really has to combine humanity with science, so medicine.
That's wonderful.
Yeah.
It's a nice combination, yeah.
Thank you. And also I was terribly homesick. So I said, my future career has to combine Eastern medicine as well. So that make it very natural. And then my third year, after my third year college, I did a summer internship at an acupuncture clinic. I saw over 200 patients, more than 100 were cancer patients.
Oh, my goodness, okay.
Yeah, and then they basically said, they knew I was pre-med student, and they said, Ting, this is the future. They said the integrative therapy, like acupuncture, even herbal supplements,
Right.
really helps strengthening them during the
Okay.
process. And at that time, their oncologists just knew very little about it. They were like just doing everything on their own. They said, this is the future, like do more research on this, like to lead us in the future. I was like, oh, that sounds great.
And acupuncture has grown over a period of time.
Oh,
I mean,
completely.
I mean, people were totally clueless about acupuncture, except in those days, that was the only probably one of the only remedies besides Ayurvedic treatments and all that stuff.
Yeah, but the truth is, it started in China thousands of years ago. So, like people were using it for pain reduction, everything for a long time. Even increase like fertility and all this. So
Oh, my goodness,
people
wow,
on the
okay.
east side like use acupuncture and supplements quite a bit, but not necessarily here on the west side.
Okay.
But then, over the past 30 years, things had really changed. But that was my career crystallizing moment.
Okay.
Yeah, so I decided to follow that and then got educated at Johns Hopkins Medical School, residency, fellowship, and then was a faculty at University of Maryland, then Memorial Sloan Kettering Cancer Center, and then got recruited here 2 years ago.
Oh, my goodness, wow.
Yeah.
Well, you have a very impressive background and practical experience of a lot of things. But talk about a little bit about the integrative oncology. How would you define for the folks who are listening to this, who may not even have heard about integrative approach to oncology? They've only heard about medical oncologist and oncologists per se.
Sure.
So talk about that, please. And what is what is its mission? Now, you're also the past president. You've been the past president of Society of Integrative Oncology Group.
Yes.
So maybe talk about that a little
Sure.
bit. That would be good.
Certainly. Our society, we have a publication, so we formally defined integrative oncology is a patient-centered evidence-informed field of comprehensive cancer care that utilize body, mind practice, natural products, and lifestyle modification from different traditions alongside conventional cancer treatments.
Okay.
So that's the official definition. And our mission is really to optimize health, improve quality of life and clinical outcomes across the cancer care continuum, and empower individual to become active participant before, during, and after cancer treatment.
Now, obviously, the integrative oncology is spread within all cancer areas. But specific to the breast cancer for women, how have you seen, or how do you see that to be applied for these women?
So especially for breast patients, because I'm also a board certified breast medical oncologist.
Oh, okay.
Yeah.
Okay.
So for
Perfect.
by selection or all this, majority of my integrative medicine patients are breast patients.
Okay.
And when I was at Memorial Sloan Kettering Cancer Center, majority of my breast cancer patients are very interested in integrative medicine.
Oh, really? Okay.
Yeah,
Okay.
so at least based on my observation and clinical trials support that too,
Okay.
it's really significantly improve their quality of life, really support them from the beginning to the end of their cancer journey.
So then I think the question comes is, I think before I get into the other part of the question, maybe it would be good for our audience to understand from your perspective, if you can walk through your integrative oncology consults. You know,
Sure.
when you consult with them,
Sure.
you know,
Yeah.
how do you, and then how do you really decide specific integrative therapies would benefit these patients?
Certainly. So yeah. So we usually allocate about 1 hour on integrated medicine consultation. So usually patient will come with their significant others, and usually the more support they have, the
Yeah.
better. And then they will come to join me in the consultation room.
Okay.
Then I would try to get to know them. Of course, at the beginning, I'll look at through their chart profile, just have some understanding. But
Right.
I always start with, so and so, nice meeting you and your significant other, and I would like to, how can I help you? I would like to hear from you, like how you will benefit the most from this visit. And then sometimes they would tell me exactly what they need. For example, I'm taking these herbs and it is going to interfere with medication and stuff.
Okay.
But other time, not so rarely, they would say, I'm not quite sure I'm here. Yeah, like
Because they don't
right,
know. Yeah,
Right.
exactly,
So
yeah.
tell me what you do.
Right.
So then I would usually open up saying, what is integrative oncology and how is it different from alternative medicine?
Right.
What we do is evidence-based complementary therapy and then alongside the conventional treatment, rather than alternative medicine is instead of conventional treatment. And then basically talk about different modalities in integrative oncology. For example, we talk about diet recommendation, exercise recommendation, the healthy living part.
Okay.
And then talk about different modalities such as meditation, mindfulness, acupuncture, massage.
Do
all this.
you provide them? Interesting that you say that. Do you provide them some kind of a guidance about meditation or yoga or exercise,
Yes.
or do you lead them to your people who are helping within Dana-Farber? How do you?
It's 1 hour, so we do have lots of time. So I
Okay.
usually give them some fundamental concept of what
Okay.
is mindfulness, what is meditation, what is yoga, what is Tai Chi, what is Qigong. So rather than just after seeing me, go see those people to find out more about it.
Okay.
So it's like kind of the beginning
Okay.
of this. Of course, for them to get familiar with it, they definitely need to spend more time and
Sure.
actually talk to the experts.
And how do they feel as a patient when they're listening to you? Are they buying into that philosophy of holistic approach or complementary approach
Yes.
to medicine?
They are. I think it's self-selected already. Like
Okay.
the reason, they see an integrated medicine consult, usually the fact they show up suggests they're opening to this concept.
They came on their own because somebody.
Yeah.
Because one of the reason I feel is it's not out there. The awareness is not as high as it should be. It's getting there.
Right.
I came to know about integrative oncology after the fact, not
Right.
during the fact.
Right.
And that's where I'm kind of coming from, that now it goes back into the how are you now positioning yourself that folks are becoming more aware of integrative oncology. It plays a significant role, and who and why should be coming to be part of that.
Everyone.
Okay.
If it's up to me, it's like everyone. The moment they get diagnosed
I agree.
with cancer,
I agree.
come to see us because we have so much to offer, and there's so much evidence suggesting integrative medicine.
And this evidence is clinical based, or it is. Talk about that evidence a little bit.
Sure. So there are different levels of evidence, right? At the beginning, especially for the dietary supplements, it's usually in vivo, in vitro. So it's like, on petri dish and in vitro, and in vivo is animal study.
Yeah.
But then very rarely is clinical study. However, on like modalities such as acupuncture, mindfulness, tons of clinical trials, meaning on human. Yeah, so to the point, there's basically SIO have a joint guideline with ASCO, American Society of Clinical Oncology.
Oh, really? Okay.
Yeah, we have multiple guidelines, and number one came out 3 years ago. Is one of the authors on that article. It basically talk about pain, like integrated medicine for pain, cancer-related pain,
Right.
and then basically recommend patients who have aromatase inhibitor-induced joint muscle pain should be referred to acupuncture based on I think 5 systematic review and 6 randomized control trial.
Okay.
Yeah, it showed acupuncture significantly reduced aromatase inhibitor.
See, this is something new. I didn't know that.
Really?
I was
Yeah.
not. I knew about acupuncture.
Right.
I didn't know that there was data existing
Right.
that supports
Yeah.
supports this evidence. Okay.
Yeah, so that's data support acupuncture. And for mindfulness, there's lots of data as well, to the point, I think 2 years ago, we have another guideline, SIO ASCO guideline for integrative medicine therapy for cancer-related anxiety, depression. Across the board, mindfulness-based intervention is recommended. Minimum side effects, significant benefit in reducing.
And do you know statistically the number of patients who really benefited out of a study approximately? But that
That's a
would
great
be a question
yeah.
that the patient would ask. I say, okay, out of 10 patients, how many patients would really see the benefit of this acupuncture?
Right.
Was this statistically significant?
It was statistically significant. For example, the acupuncture for aromatase inhibitor-induced joint muscle pain,
Okay.
60% of patients
Oh,
have
fantastic.
greater than 2 points out on the 0 to 10-point scale.
Wow.
Pain reduction. It's
Okay.
significant.
Oh, wow.
Yeah.
And another thing that I'm looking for, this is like I'm hoping
Right.
that, when patients are on chemo, obviously chemo basically sort of weakens their body, for a better word, weakens their body. And we feel I've been talking to Neil and a couple other oncologists, and they said the combination of holistic treatment with chemo has a very powerful effect, and also helps the chemo to work better.
I think so. Yeah.
So, has there been any studies done in combination with this? Because this is something that I've not seen pharma companies have supported
Right.
or have done.
Right.
So maybe you can give some
Sure.
insight on that.
Sure. So yeah, I feel like there are multiple stages of integrative oncology research. I feel
Okay.
like right now the most research focus on symptom reduction, like acupuncture reduce pain, mindfulness based intervention reduce anxiety, and then CBTI, cognitive behavior therapy,
Okay.
and Tai Chi help reduce insomnia.
Tai Chi also, okay.
Yes,
Tai Chi
there
is
has
powerful.
been study.
Yes. Okay.
And yoga too for breast
Yo-
cancer
okay.
patients help sleep. So it's primarily focused on symptoms. But then I feel like the next stage, which we're applying for grants, and hopefully federal funding is more steady.
Right.
Yeah, so we're looking at we know it's reduce symptoms and reduce hot flashes and all this, and then can it help improve the adherence, treatment adherence, like used together. Say people on aromatase inhibitor have so much joint pain.
Right.
If we offer them acupuncture, can we help them stay on AI, aromatase inhibitor, for longer? So I think it's anecdotally that's help. Like
Okay.
I have patients saying, without acupuncture, there's no way I can take this for 5 years
Right.
and stuff. But then we need more data, so we're being innovative.
Eventually, we
Yeah.
would like to see that these type of treatments can eventually either eliminate the use of chemo
Yeah.
after they've tried it.
Yeah.
After they've used that, they can probably minimize the reduction or probably take away chemo out of the picture.
Funny you mentioned that. The ASCO, American Society of Clinical Oncology, just finished. Neil and I were all there.
Yeah.
So one of the most eye-catching presentation you may have heard is the challenge trial. So
No, I've not, but I want to read
happy
that.
to talk
Okay.
about it. Yeah.
Okay.
It just it's basically is I think 880 plus patients with stage 2 and 3 colorectal cancer.
Oh, wow. Okay.
And then finished surgery, finished chemo, and then got randomized to one group is exercise. It's about like 150 minutes per week, just rigorous exercise.
Okay.
Or moderate exercise. The other group is just education. And then there's 3 years intervention, and then they follow up survival. So the exercise group improved the survival by 7%.
Oh, wow.
I know, it's huge. It's,
wow.
It's like, and then he has this table. Basically, it's like exercise 7%, chemotherapy 5%, and immunotherapy is like 8%, and then side effects, exercise is like 18% muscle joint pain, and it was nothing.
I think that's incredible.
Yeah, standing ovation. Everyone was talking about it.
I think that's fantastic. This is right up our alley where this is very important. That's the kind of a significance we want to see. I think the data is out there.
Yes.
I was talking to Lee out in California, and he has shown how the exercise done by women with breast cancer, but 4 times a week, can either revert or reduce the impact on cancer.
Yeah, I know Lee well too from MSK. Yes.
I know.
Yeah. So I think the third way to do research is really integrative medicine can treat cancer.
Right.
So I think we're moving towards that. Yeah, reduce symptoms, improve adherence, and potentially treat cancer. Yeah.
Now, it's interesting you mentioned that majority of your patients, when you say majority of your patients are in breast cancer, is that more than 50% or more than 70%?
Yeah, more than 50% at least.
Okay.
Here, at Dana-Farber. So what happened is now we have a team. So it's me and also a physician assistant, Dan Glidden. So he used to be a GU physician assistant. So like focusing on treating prostate cancer patients. So his patient pool, majority of prostate cancer patients. And I myself, I'm board certified breast medical oncologist. So it's usually like I have lots of breast patients.
I think you probably answered this question, but I just want to make sure that it is covered clearly. How does integrative oncology enhance treatment outcomes and quality of life for the breast cancer women?
So I think integrative medicine, by basically reducing all the symptoms, can significantly improve outcomes.
So you highly encourage women who are having breast cancer should be looking for integrative oncologist.
I think so.
As part of their treatment.
I think so. Yeah.
And so I think the question comes in that when they are seen by the medical oncologist, I think recommendation through medical oncologist and referring them to integrative oncologist would be ideal.
Yes.
But I don't see that happening. Are you doing anything in that regards to become part of that team to begin with, so that you should be at the forefront with the medical oncologist to run this thing and provide the benefit to the patient that they deserve right from the get-go?
Both Jennifer and I are part of the breast group at Dana-Farber, because we both are like medical oncologists. So the breast group, among all services, the breast group refers the highest number of patients to our service. I think potentially the bottleneck part is our availability. So there are just 2 of us. There are like 30 plus medical oncologists here. Imagine if they refer all the patients they see us, our wait list will be 2 years plus.
So how do you, then the question comes in, the second part of the question is that what are you, as Dr. Ting Bao, as a past president of SIO,
Yes.
and now the co-director of the Zakim Center, are you doing in that regards to so that patients can have benefit of integrative oncologist?
So education. So I think that's a key. So we go to our breast medical oncologist periodically, like tell them what's new with Zakim Center, and then I give talks to the breast group and the whole like medical oncology
Okay.
group. Basically, talk about what we do. Like we have my Zakim is a website that even if they haven't seen us, they can of course register to the my Zakim website and benefit from all this virtual presence and stuff. So education is the key. Basically, educate our providers, educate our patients, and
Are you doing some satellite programs in that regards, or
not yet? But I think if we have the availability, certainly, yeah.
maybe we should start a podcast in that. In
Why
that
not?
area, right?
Yeah.
That would be good.
Definitely, yeah. I feel like there's one question I didn't get to answer you. Like you said during integrative medicine consultation, like how do I decide? There's so many integrative medicine approaches.
Yes.
Yeah, which one do I like recommend? So I think it's primarily based on two things. One is evidence. Say if there has certain condition, then I first think, okay, which integrative medicine modality has the highest evidence behind it? Then I would recommend that. For example, the AI pain, I would recommend potentially acupuncture.
Right.
And then, anxiety, mindfulness-based intervention.
Okay.
Another factor is individual, like patients. Like
Okay.
some people, they're afraid of needles. I'm not going to force them
Yeah,
to do
yeah, yeah.
acupuncture.
Right.
And then, and also financial reason, like, and availability. Say if they have a massage therapist near where they live, I may recommend massage for their pain, just because there's also data suggesting massage help with cancer-related
Does
pain.
circulation and all that stuff. Okay.
Yeah. So it's kind of based on those two major factors. Sometimes it's also insurance.
Thank you for addressing that. I think
Sure.
that's very valuable because I
Yeah.
think that kind of gives you a better indication of which patient would be more viable,
Right.
or more practically effective for such treatment.
Yeah.
That's very good.
Yeah, and another area of our research is try to make integrative medicine personalized because we know like not everyone respond to say acupuncture the same.
Oh, exactly.
Yeah, some people maybe respond to massage better. Then how do you decide? Yeah, so that's further research.
There are a lot of talk about meditation. There's a lot of talk about yoga.
Yes.
How does that play a role in addition to some of these factors we talk about: exercise, diet, acupuncture, counseling? I see that. I mean, I'm doing meditation almost 45 minutes every day,
Wow.
and yoga too,
Right.
and it helped me quite a bit just to kind of build my immunity,
Sure.
help me more relaxed, stress free, because stress is a major cause of a lot of the problems. What has been your take on that?
So I look at them I think meditation and yoga are sort of like self-care. You can do it on your own. Acupuncture, massage, you have to go somewhere,
Go somewhere,
to have
right,
it done on you.
Good point.
So in a way, I see if possible, everyone should be doing meditation. And if they like yoga, to be honest, some people don't.
Some
like
people
yoga.
don't.
Yeah. So some people like moving all the time. Then I recommend Tai Chi because it's always moving. Yeah, and yoga focus more on like stretching. Of course, there's hot yoga too. But yeah, so it's different. But
because not every women may not be able to do all the things which we understand, but
in a way,
some they should be adapting to certain habits for some of these areas.
So a few things I usually like teach my patients in the office. One is deep breathing exercise. Yeah, it's like
excellent. Yes.
Within 1 minute, it's like both of us really like calm down.
Yeah.
So I think everyone should be able to do it. It takes like 1 to 5 minutes and make a huge difference.
The funny thing is, we all know it.
Yeah.
It's a matter of application.
Yes.
And especially when women are having the cancer, psychologically they are so overwhelmed, and that fear that they're living with,
Right.
and sometimes emotionally they are so tired
Right.
that they become lazy to do these things. Do you have any suggestions for those type of women who go through that?
Um, just do it.
Just
Yeah, because all the study shows is really helpful.
right.
And yeah, and the moment, and it's sort of like, even exercise is a little bit exercise make a big difference from no
Oh,
exercise.
yeah, absolutely.
So
I
just
agree.
a little bit and make it into daily routine, then that's make a big difference in their life. Yeah,
And one more question that kind of triggered my thought
of course.
on your response. There are another group of women
Hmm.
who don't have cancer, but
Hmm.
they have a family history of cancer.
Sure.
What
Yeah.
is the recommendation that you do to them? Because
Hmm.
we all live in this
Hmm.
this take a pill
Right.
philosophy.
Right.
You have a pain, you take a pill.
Right.
But when you don't have a pain,
Mm.
that's when you should be taking care of your stuff.
True. True.
What are your recommendations for that?
A healthy lifestyle, it help prevent cancer. So
Right.
do it now. Yeah. And then, for example, that challenge trial, when we look at it, it basically prevent the colorectal cancer from recurring, right?
Right.
Also prevent breast cancer from developing.
Well,
Yeah,
okay.
it's compared to the control group, it's significantly. So
Okay.
it's almost like a cancer prevention trial as
Right.
well. Yeah.
Right. Right.
Yeah.
So the final question, I think this is a very good conversation we're having. I wish I could have more time to do that. But what are the few important do's and don'ts for patients and caregivers considering integrative oncology as part of their healing journey?
Definitely. So, number one is advocate for integrative oncology care.
Okay.
So, bring this up. When you have cancer, just talk to your oncologist, talk to your nurse, say, where can I see an integrative oncologist or something? And the majority of the major cancer centers have integrative medicine service already. So, the resources are out there. You just
Okay.
need to ask.
Now they've
Yeah.
increased too.
Oh,
Yeah.
totally.
Yeah,
I think
exactly.
soon enough, it may be a requirement to be a
Right.
comprehensive cancer center. And then second is to ask for evidence. Like certain people would recommend certain thing, but then you always
Show me the proof.
exactly like why, right?
yeah,
It's
exactly.
always good to know the evidence. Yeah,
Right.
and then do communicate with your entire team. Don't
Okay.
like just do one thing and then not to tell the other and all this. So just make it open, right? Yeah, everyone is trying to take care of you.
Right.
Just the whole entire team should know.
Okay.
And then make sure you work with qualified practitioner. Yes, that's important.
There have been a couple of cases where we
Yeah.
won't get into that, but you have to be smart enough to know that you're talking to the qualified doctor.
Exactly. Exactly. And then don't. So number one, I usually say don't replace conventional therapy with alternative medicine.
Okay.
Especially for breast cancer patients. Yeah, it double the risk of death from breast cancer if patients stop using the conventional treatment and just go alternative. I myself witnessed a few. It's kind of sad.
Okay. So you want to make sure that there is a combination.
Yes.
Always works.
Yes. Yeah. I think the smartest people is to bring the best of both worlds together rather than just go the other way.
Okay.
Yeah. And then also don't believe in those like miracle cure thing.
I know.
Yeah. Right. Yeah.
We used to hear about this horse pill that is
Mhm.
out there. The guy took in stage 4 and he got cured.
I know.
It was very difficult for me to believe in something like that, but
Yeah.
you're right.
Yeah. Yeah, definitely. And then I think that's it.
Okay.
Yeah.
Okay. Now these are very good points that you have mentioned, Dr. Bao. I think audience listening to this podcast should benefit from the fact that there is a meaningful treatments out there, especially from a holistic point. And I think I think the question is not the question is the point is that a lot of these people are not aware of integrative oncology. They need to be aware of this. And I think hopefully through this podcast, the word is getting out there where you should be asking your doctors about integrative oncology. What that does, it's a complementary medicine, which has shown significant improvement if you combine it together. So with that, we appreciate you joining us, Dr. Bao, and thank you very much for your time.
Sure.
And thank you, audience, for listening to us. Again, go to our website for your support, alkaori.org, And all the information is out there for your help and for your understanding. And God bless you guys. Talk to you next time. Thank you.